Are you woke? I mean, are you so woke that you are so fragile that just hearing the opinion of somebody else might actually break you? If that is you, then please just scroll on through, go to the next video, because what you are going to hear is going to be too much for you, because you will break if you think you are that fragile. We're going to talk about fragile patients. We're going to talk about my fragile patients that we send to centers all across the country. And one of those is Los Angeles Fetal Surgery, where they say they've been taking care of the most fragile patients, where saving lives is actually their specialty. Well, who are these patients? These are patients that have spina bifida defects, and they are repairing these spina bifida defects. These are patients that are receiving laser vascular surgery to save their lives. They are extremely fragile, but you know what? These patients are fragile, but they're heroic, and they are in the womb still. Yes, at Los Angeles Fetal Surgery, they have performed spina bifida corrective surgery. First, they would bring out the uterus, open up the uterus, and then they'd repair the defect. Then they would move it along, and they just would open up the skin, remove the uterus, and then they would do a fetoscopic surgery. Now they're putting scopes actually through the skin of the mom, through the wall of the uterus, and they are repairing these fragile patients there on the inside. They are doing about 150 cases per year, and they have done over 800 surgeries of laser vascular surgery for something called twin-twin transfusion syndrome, where a pair of identical twins are sharing a placenta, but they're not sharing evenly. And so they actually will go in with a laser, and they will divide the placenta in two and say, this is your side of the placenta, this is your side of the placenta. Now you two play nice and share well, and we will deliver you in a couple of months. These patients are fragile, but as fragile as these patients are, we treat them as patients and we can cure them in the womb. But the question is, if they are patients and they are that fragile, and they are centers that are dedicating their lives and their careers and their resources to saving their lives, how can these same babies also be aborted at another center right in that same city? A patient is a person, no matter how small, and we need to stand for those who can't stand for themselves. We need to be a voice for the voiceless, and we need to put our foot down and say, we will stand for all patients because they all have rights. They are fragile, and they are the most fragile patients, and we will defend our fragile patients. I'm Dr. Bill Lyle. If you have any questions, you can contact me through my website, prolifedoc.org, and have a great day.